Hello and welcome to ECG a Day. Here we'll go through a single tracing at an intermediate level. I was asked to see this patient for a fast heart rhythm, and this is the tracing that was provided. So you can go ahead and pause this video here and have a look at it yourself and go through the systematic approach that we discussed in the past. The first thing that strikes me about this ECG is that it's very noisy. I see a lot of this high frequency noise throughout the entire tracing, and there's also a low frequency, this wandering baseline throughout the entire tracing. So right away my index of suspicion for artifact goes up substantially, and also I'm very careful making any definitive diagnoses on such noisy tracings. I generally want a nice clean tracing to examine carefully. And whenever I see a tracing like this, I always look for the time of day that it was recorded, and the time of day is not given here, so we will move on. This is just a quick side note. The next thing I look at when I suspect artifact is look at every QRS in all the leads and ask yourself a question: does it look real? And I see that there is two populations of QRS complexes. There is this narrow QRS complex here that looks like this in the bottom lead, and then there is a wide QRS complex, or a wider one, here that looks like this in the bottom lead. And I see these two population of QRS complexes, and certainly the narrow one looks extremely narrow, almost too narrow to be real. It's not definitive, but we'll keep that on the back of our minds. Both of these populations of QRS complexes have their own rate, and they seem to be not affecting each other. So if I look at this rate as the interval between wider QRS to next wide QRS, and this interval as the narrower QRS to the other narrower QRS, and they're kind of walking through each other and not influencing each other at all. So you can see from the wide to the narrow beat here, this interval from the wide to narrow beat shortens, and here they're completely over top of one another, and they don't seem to influence one another at all. And there's something very interesting happening right here. We see a narrow QRS in the early part of the ST segment of a wide QRS. And this is non-physiologic. You can't have a QRS in the ST segment of another QRS. It's because the first QRS has finished depolarizing the ventricles, and the ventricles are not able to be depolarized again until the myocardium recovers, which generally happens towards the end of the ST segment. So right away, I'm suspicious one of these QRS complexes is non-physiologic. So let's look at some other features. We know that the QRS complex has an ST segment and a T wave. And I see this low frequency wide signal here that follows each wide QRS complex. And this certainly looks like a T wave. This looks like a physiologic T wave. And there is something here that looks like a P wave before each wide QRS complex. So I think the wide ones are real and the narrow ones are artifact, because the narrow ones they have nothing before them and not a whole lot after them either. So I'm fairly convinced that the narrow QRSs are actually artifact and the wide QRSs are real, and the diagnosis is sinus bradycardia. And certainly when you look at this one in particular, you can see that after the QRS, the baseline shifts. And this is not something a normal QRS would do. This helps confirm my suspicion that the narrow QRSs are artifact. So there's two main learning points from this tracing. The first one is be very careful making a diagnosis on a noisy tracing. If somebody hands you a tracing with high frequency signal or a very wandering baseline, be very suspicious that there may be presence of artifact and the diagnosis, and you can never be too certain about the diagnosis. The second learning point is if you suspect artifact in a tracing, look for non-physiologic features. So look for so every QRS complex, look at all the leads, look to see, does it look physiologic? Is it too narrow to be real? Is it too wide to be real? Does it have an ST segment and a T wave? And certainly if a QRS falls on an ST segment of a QRS that you know is real, then automatically I'm very suspicious that it may be artifact. So use all of these tools and use all the leads available to you if you see a very noisy tracing. Great, and thank you for your attention, and see you next time.